This little pill? It's immediate-release carbidopa levodopa, the standard of care for Parkinson's disease since the 1970s. Like the fleeting era of 8-track tapes, IRCDLD wears off fast. Because the pill dissolves in the stomach, the levodopa may not get to the proximal small intestine, where it is best absorbed. When levodopa wears off quickly, doses don't last long. Patients experience off time and will require more frequent daily dosing to control their symptoms. Luckily, the world has advanced a lot since the 70s, changing and evolving all around us. So we've made it our mission to innovate levodopa delivery too. The result? CREXONT. CREXONT combines the advantages of immediate release and extended release. While IR granules dissolve rapidly, the ER pellets are what make CREXONT truly unique. That's because the ER pellets are designed to move through the stomach without disintegrating too soon. They get to the proximal small intestine, where the novel mucoadhesive polymer is designed to adhere to the optimal area of absorption, allowing for the slow release of levodopa. Because of this advanced technology, CREXONT sustains levodopa plasma concentrations longer than both Rytary and IRCDLD. Levodopa is a golden oldie, and like rotary phones and enormous computers, its destiny was to be improved. CREXONT has transformed innovation into duration to advance the standard of care into the next era for the Parkinson's community.
Indication: CREXONT, carbidopa and levodopa extended-release capsules is a prescription medication for the treatment of Parkinson's disease caused by infection or inflammation of the brain, or Parkinson's disease-like symptoms that may result from carbon monoxide or manganese poisoning in adults. Important safety information. Do not take CREXONT with antidepressant medications known as non-selective monoamine oxidase MAO inhibitors. Do not take CREXONT with other carbidopa-levodopa preparations without consulting your healthcare provider. CREXONT may cause falling asleep during activities of daily living, somnolence, or dizziness. Avoid activities that require alertness, such as driving and operating machinery, until you know how CREXONT affects you. The most common side effects that may occur with CREXONT are nausea and anxiety. It is important to avoid sudden discontinuation or rapid dose reduction of CREXONT. If you are discontinuing CREXONT, work with your healthcare provider to taper the dose over time to reduce the risk of fever or confusion. You may take CREXONT with or without food, but taking it with food may decrease or delay its effect. Consider taking the first dose of the day about 1 to 2 hours before eating. Swallow CREXONT whole. Do not chew, divide, or crush the capsules. Do not take CREXONT with alcohol. Tell your healthcare provider if you have any heart conditions, especially if you have had a heart attack or irregular heartbeats, experience hallucinations or abnormal thoughts and behaviors, have an inability to control urges to gamble, have increased sexual urges, or experience other intense urges, have thoughts of suicide or have attempted suicide, have abnormal involuntary movements that appear or get worse during treatment, have ever had a peptic ulcer or glaucoma, become or intend to become pregnant. Based on animal data, CREXONT may cause fetal harm. Are breastfeeding during therapy. To report suspected adverse reactions, contact Amneal Specialty, a division of Amneal Pharmaceuticals LLC, at 1-877-835-5472 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please read the full prescribing information. For more information, talk to your healthcare provider.